Diabetes is a medical condition that causes high blood glucose levels. Now, did you know that besides many other eyesight complications, diabetes can also lead to cataracts in the eyes? Hi, my name is Madhur Kotharay, and I'm going to walk you through this whole topic of cataracts caused by diabetes. What are cataracts? Let us look at this illustration. Now, this is a cut section of our eye. On the left is the front of the eye, on the right is the rear side of the eye. Pay good attention to this part, which is called the lens of the eye. This lens is made of transparent proteins. It allows the rays from any image to fall on the back of the eye called retina. A transparent lens provides a clear vision. You can see that in this image. The lens tends to become cloudy due to various reasons such as aging or diabetes. As you can see, when the lens becomes opaque, it prevents the light rays from passing through and focusing on the retina properly. Keep looking at the lens and see how it is getting cloudy. Now let us go back to the original illustration and you can see how the lens was clear. Now look at the view on the right. See how it gets cloudier progressively and how the colors start fading or become yellowish. A cataract is a cloudy area inside the lens. How diabetes causes cataracts? You can think of egg white, which is transparent to start with and turns white on heating. Actually, egg white should be called egg transparent because that's how it is to start with. Now, egg white turns white because the protein composition of the egg white changes between 60 to 65 degrees Celsius. Similarly, the protein composition of the eye lens changes in cataracts from transparent to opaque. There is fluid called aqueous humor which fills the front of the eye. It is just behind the lens in this illustration. It supplies oxygen and glucose to the lens of the eye. As the sugar levels rise in the aqueous humor and the lens in a diabetic person, the lens can swell due to something called osmotic pressure. The swollen lens does not focus light correctly onto the retina. The eyesight can become blurry, preventing sharp focusing of the image on the retina. So one may need to change one's spectacle prescription number. At this point, the problem is still reversible. Get the blood sugar in control and the swollen lens will slowly revert back to the earlier shape, bringing the eyesight to normal levels. But if these blood glucose levels stay high for a longer period, permanent damage starts happening to the lens. Now, I cannot explain the next part in simple English, so I'll stay a bit technical. You can consider this part to be for healthcare professionals amongst you. It seems there are three ways diabetes leads to cataracts. First, normally the cells use glucose for energy and whatever glucose is not used gets converted to something called sorbitol. The lens has an enzyme that converts glucose to that chemical. With high blood sugar levels, this sorbitol starts accumulating inside the lens. It pulls more water into the lens fibers. These fibers swell and rupture. This makes them more opaque, leading to cataracts. Apparently, until the glucose levels cross 100 mg per deciliter or 5.5 millimoles per liter or 5.1% of glycated hemoglobin or HbA1c, this is not a problem. But when glucose levels rise above this, the sorbitol related damage starts accumulating. It is called activated polyol pathway and it is one of the main reasons for all diabetes related damage around the body. Second, non-enzymatic glycation of the lens proteins. Sorbitol causes glycation of nitrogen in proteins. This produces something called advanced glycation end products or AGE, which are damaging to the lens through various mechanisms. Third, oxidative stress. This polyol pathway increases the concentration of reactive oxygen species which cause a lot of oxidative damage. If you find this information useful, please click the like button below. You can even subscribe to this channel by clicking in the circle on the right hand side. To view videos on similar topics, click in the box in the middle and click in the box on the left side to view some of our most popular videos. I hope you learned something new in this video because ignorance is a very dangerous strategy if you want to keep your eyes healthy in diabetes.